top NCLEX exam. Questions every nurse must know. Hey, future nurses, are you preparing for the NCLEX and feeling that familiar knot of anxiety in your stomach? Trust me, I've been there. Those endless pages of notes, the practice questions that seem impossible. It can feel like you're drowning in information. But guess what? You're not alone. I'm Gopal, and I'm here to help you conquer the NCLEX and achieve your dream of becoming a registered nurse. In this video, we're going to tackle some of the most common and, let's be honest, sometimes tricky NCLEX questions that could make all the difference on exam day. So grab your notebooks, find a comfy spot, and get ready to boost your confidence. Stick with me, because by the end of this video, you'll be well on your way to acing that exam and starting your incredible nursing journey. Let's jump right into a scenario you're likely to face as a nurse prioritizing patient care. Remember, time is precious in a hospital setting, and you need to know who needs your attention first. Imagine this. You're on the floor, and your patients have a range of needs. You have a post-operative patient whose vitals are currently stable, a patient with COPD who has an SpO2 of 89%, a diabetic patient with a blood glucose level of 450 milligrams per deciliter, and a patient reporting chest pain. Who are you seeing first? If you said the patient with chest pain, you're absolutely right. Chest pain could signal a potentially life-threatening cardiac event, and that needs immediate assessment and intervention. Remember, always prioritize based on what could cause the most harm to your patient. Next up, let's talk medications. Pharmacology is a huge part of the NCLEX and your future nursing practice. You'll need to know your medications inside and out, including their actions, side effects, and most importantly, their antidotes. Here's a question to test your knowledge. What is the antidote for warfarin toxicity? Is it A, vitamin K, B, protamine sulfate, C, atropine, or D, naloxone? The correct answer is A, vitamin K. Warfarin is a blood thinner, and vitamin K helps to reverse its effects, especially in cases of excessive bleeding. Knowing your antidotes is crucial for ensuring patient safety. Chapter 3. Now let's shift gears to patient education. As nurses, we're not just caregivers, we're educators too. We empower our patients with the knowledge they need to manage their health. Imagine you're discharging a patient who's been prescribed digoxin. What's the most important thing to teach them? A, check your pulse before taking the medication. B, avoid all green leafy vegetables. C, stop taking the drug if you feel dizzy. D, take with antacids for better absorption. The answer is A, digoxin can slow down the heart rate, so it's crucial for patients to check their pulse before each dose. This simple step can help prevent complications like bradycardia. Chapter 4. Let's talk about infection control. As nurses, we're on the front lines of preventing the spread of infections. Knowing your isolation precautions is like having a superpower. Imagine you're caring for a patient with tuberculosis. What personal protective equipment or PPE would you wear? Would it be A, gloves, B, surgical mask, C, N95 mask, or D, gown and gloves? If you said C, N95 mask, you're spot on. Tuberculosis is an airborne illness, meaning it spreads through tiny droplets in the air. An N95 mask filters out those particles, protecting you and other patients. Chapter 5. Finally, let's head to the labor and delivery unit and talk about maternal newborn care. Those first few moments after a baby is born are critical. Imagine this. You're assessing a newborn and their heart rate is 90 beats per minute. What's your next step? A, start CPR. B, provide warmth. C, administer oxygen. Or D, notify the provider. The correct answer is C, administer oxygen. While a heart rate of 90 beats per minute is slightly low for a newborn, it doesn't yet warrant CPR. Providing oxygen can help stabilize the baby's heart rate. Great job, everyone. We've covered a lot of ground today, and you should be proud of yourselves. Remember, these questions are just a taste of what you might encounter on the NCLEX. The key to success is preparation. Don't be afraid to rewind this video. Take notes and practice, practice, practice. The more you familiarize yourself with these concepts, the more confident you'll feel on exam day. Do these questions help you feel more confident? Let me know in the comments. And don't forget to like this video, subscribe, and hit the notification bell so you never miss more NCLEX tips. Share this with your nursing buddies. It might just save their exam.